Hey, you, book podcaster here, and today we're diving into something really useful.
Yeah, definitely something important.
Let's be real. Sometimes figuring out what's going on with people, especially family, it can feel like, I don't know, trying to decode a medical textbook after an all-nighter.
Right. Right. Bit overwhelming.
Totally. But today we're doing a deep dive into something super important, especially when you're navigating the world and, supporting the people around you, understanding how families play a role in mental health.
We're unpacking Chapter 10, Intervention with Families, from a great resource, Psychiatric Mental Health Nursing, Concepts of Care and Evidence-Based Practice by Townsend and Morgan.
Exactly. And our mission basically is to pull out the most crucial insights about family dynamics and mental health. The goal is to help you understand these complex relationships better, whether it's in your own life or maybe when you're supporting others.
Okay, so let's jump in. The foundational idea, really, is that families aren't just bystanders in mental health. They're often, intertwined with both the challenges and the solutions.
Yeah, that's so true. It's not like one person's dealing with something totally separate. Families can be these incredible sources of support, like anchors.
Vital support.
But honestly, they can also sometimes, maybe unintentionally, add to the stress. So understanding those family roles, their values, how they talk to each other, it's key to getting to the root of mental health stuff.
And it really makes a difference. I mean, the positive impact of involving families is pretty significant.
Yeah.
We see reduced relapse rates,
Right.
people sticking to their medication plans better, and generally just enhanced recovery overall.
Yeah, and it's not just a feeling. That 2023 NAMI study, it dropped some really compelling numbers. Patients with supportive family involvement were, 40% more likely to stick to their treatment plans?
40%. That's huge. A
Yeah,
real game changer.
definitely.
And maybe we should clarify what we mean by family because it's broader than many people think.
Good point. It's not just blood relatives.
Exactly. It's about who provides that support, who shares responsibility, who's truly committed. It's that circle.
Totally. So, yeah, your nuclear family, sure, but also single parent families just rocking it.
hmm
Multi generational households, same sex parents, foster and adoptive families, and those amazing chosen families. The friends who are family.
And understanding this broad definition is so important for providing culturally competent care.
Yeah.
What works for one family structure might not fit another. Right.
Absolutely. Okay, so let's get into some of the theories behind this. The chapter talks about family systems theory, particularly Bowen's work.
Right. The core idea there is that the family is an interdependent system. Think of it like
Hmm.
an emotional unit. What affects one person tends to ripple out and affect everyone.
Like a mobile hanging from the ceiling. If you touch one part, the whole thing moves.
That's a great way to put it. And one key concept from Bowen is triangles.
Ah, yes. That sounds potentially dramatic.
It can be. It's when tension builds between two people and they bring in a third person, often unconsciously, to kind of diffuse that tension.
Like maybe parents are arguing and the child starts acting out, shifting the focus.
Exactly that. It might seem to relieve pressure short term, but it avoids dealing with the original issue and isn't always, the healthiest pattern long term.
Makes sense.
And then there's differentiation of self. This is a big one. It's about being able to separate your own thoughts and feelings from the family's emotional pull.
So not getting swept up in the group anxiety.
Pretty much. It's about managing your own anxiety and responding thoughtfully rather than just reacting emotionally to everyone else. It might look like, say, taking a breath before responding to an angry comment and figuring out your feeling instead of just getting angry back.
Okay, that sounds like a bit of a superpower, especially in some family situations.
It definitely takes practice, and it connects to another concept, multi-generational transmission.
Which is?
The idea that patterns, ways of relating, coping with stress, communicating can get passed down through generations. You ever notice how your family always handles conflict in a specific way?
Oh, yeah. Like, that's just how we are.
Exactly. That could be multi-generational transmission at play. These patterns can become almost invisible because they're so ingrained.
That triangle thing makes me think of social media drama.
How so?
Well, someone posts something, someone else reacts, and suddenly a dozen other people pile on, making it way bigger instead of the original two just talking. It's like an online triangle, right?
Yeah, it's a perfect modern example. Same dynamic. Now, another helpful lens is the family life cycle.
Right. Families go through stages, just like individuals do.
Precisely. And knowing the stage helps anticipate potential stressors.
So what are the typical stages?
Well, the chapter outlines phases like launching young adults out into the world, forming new couples or partnerships, then parenting young children, navigating the adolescent years,
Okay.
dealing with the empty nest when kids leave, and eventually often supporting aging parents.
Wow, yeah. Each one definitely sounds like it comes with its own unique set of challenges.
They absolutely do.
Hmm.
And if a family gets sort of stuck in a phase or has real trouble with the transition between stages, that's often where mental health issues can surface or become more difficult.
The book had that really clear example, didn't it? About the 22-year-old with schizophrenia living with aging parents.
Yes,
Yeah.
that illustrates it well. The parents might struggle to, let go and foster independence,
Well,
understandably,
we had concern.
but that difficulty can unintentionally hinder the young adult's progress and recovery.
Mm,
It shows how complex these dynamics are.
totally. And sometimes specific roles emerge in families, especially when dealing with things like addiction or mental illness. The chapter called them dysfunctional roles.
hmm These aren't conscious choices usually, but patterns that develop.
Mm.
Like the hero.
Right. The overachiever seems like they have it all together, maybe tries to make the family look good, but they might be hiding their own struggles, like always hosting the holidays perfectly, even if they're crumbling inside.
Then there's the scapegoat. This is the person who often gets blamed for the family's problems. They might act out, kind of fulfilling that expectation.
And the lost child, the quiet one, flies under the radar, avoids conflict by withdrawing.
Don't forget the mascot. Uses humor, maybe clowns around, to deflect from the pain or tension in the family.
Yeah, it can be kind of awkward humor sometimes. And lastly, the caretaker, or sometimes called the enabler.
Right. Often means well, but their actions might actually keep the person with the illness from facing consequences or seeking help effectively. They cushion the blows, sometimes too much.
It's important to remember, though, that recognizing these roles isn't about blaming anyone.
Absolutely not. It's about understanding the system, the dynamics at play, so interventions can be more informed and empathetic.
So, how do professionals actually figure out these dynamics? What tools do they use?
Well, the chapter mentions things like genograms.
Ah, those detailed family trees that map out relationships and history, right? Like medical history, emotional patterns.
Exactly. And eco-maps, too. They show how the family connects with the outside world, work, school, friends, community support.
Visualizing the network.
hmm And structured interviews, of course, asking specific questions to gather information systematically.
And what are they trying to assess with all this?
Key areas include communication patterns. Is it open, closed? How do they handle conflict? What are the support systems like, both inside and outside the family? Their beliefs about health and illness are crucial, too.
Oh, yeah. Cultural norms around mental health can vary hugely.
Definitely. And a big one, assessing caregiver stress and burden.
Yeah.
How are the primary support people coping?
That feels critical. The chapter even flagged caregiver burnout as a major risk factor for the patient needing psychiatric hospitalization.
It makes perfect sense. If the support system collapses under the strain, everyone suffers.
So, given all this complexity, what kind of help is available for families? What interventions work?
Well, there's formal family therapy, with a
Mhm.
trained therapist working with the whole family unit on those systemic issues. Then there's psychoeducation. This is huge, basically, teaching the family about the diagnosis, the treatment, what to expect.
Hmm.
Knowledge is power.
Absolutely. Takes away some of the mystery and fear.
There are also family support groups. These can be peer-led or run by professionals. Just connecting with other families going through similar things can be incredibly validating.
Sharing experiences, tips. Yeah, I can see that being really helpful.
And finally, crisis intervention specific support to help families cope right after an acute event, like a hospitalization or a suicide attempt.
And what about the role of nurses specifically? What practical things do they do?
A lot of it builds on what we've discussed. Definitely education about the illness, medications, recognizing relapse warning signs.
Teaching communication skills too, I bet.
Oh, absolutely. Modeling and teaching healthy communication, active listening, using I feel statements instead of blaming.
I feel worried when, instead of you always.
Exactly. Encouraging healthy boundaries is vital, especially if roles have become enmeshed. Addressing cultural and spiritual needs respectfully is key.
And supporting those caregivers, reducing stigma, it's all part of it. The book gave that example of working with parents of a teen with bipolar disorder.
Right, teaching them warning signs, stressing not to blame the teen, practicing those I feel statements. Really practical stuff,
Skills that become even more essential during actual crises.
for sure. The chapter lists common crises that bring families into the mental health system: suicide attempts, psychotic breaks, needing hospitalization, substance use relapse, domestic violence. really tough situations.
Yeah. And it even mentioned that viral TikTok video from a couple of years ago, the mom filming her kid during a crisis.
That sparked a huge debate about privacy, boundaries, exploitation.
But it also highlighted the intense reality many families face and maybe, just maybe, opened up some needed conversations about coping and support.
In those acute crisis moments, the nurse's role is often about providing immediate emotional first aid.
Like psychological first aid.
Exactly. Helping to normalize the intense feelings, the grief, guilt, anger that family members might have, and gently guiding them towards longer-term support and solutions.
And we can't really talk about families today without mentioning technology, right? Social media.
Definitely. The chapter touches on the challenges parents face, especially with teenagers, the impact of social media on mental health.
All that exposure, online bullying, those curated, unrealistic images.
Even exposure to trauma online. Plus, just the sheer amount of screen time can interrupt family connection, can't it? It could lead to more disconnection.
That whole Instagram versus reality thing is so real. A family can look perfect online.
While someone behind the screen is really struggling, it's a modern layer of complexity.
So a nursing tip there would be encouraging digital boundaries.
Yeah, promoting safe tech use, maybe helping families carve out screen-free time for actual face-to-face talk. It's becoming part of family wellness now.
Okay, so wrapping this all up, this deep dive really underscores that family members are often like the first responders in a mental health situation.
They really are. And they need support, education, and understanding just as much as the individual facing the diagnosis.
And nurses, other professionals, play that crucial role in guiding them, giving them tools, connecting them to resources.
The ultimate goal isn't just coping day to day. It's about helping create these resilient, healing environments where real recovery can happen, not just managing, but thriving.
That really drives it home.
So, maybe something for you to think about. Reflect on the communication patterns in your own support network, whether it's family by blood or choice. Do you see any of those roles or dynamics we talked about? Even just recognizing them, and then maybe thinking, what might happen if just one small thing shifted?
That's a powerful thought to leave with. Okay, you have really dug deep with us today. This stuff, it isn't always easy to talk about or think about.
No, it's complex.
But understanding these family dynamics really can make a huge difference, whether it's for you personally or for how you support the people you care about. Remember, just taking this time to learn and grow, that's what matters. You've got this.
Take care of yourself.